So I'm going to talk about defining the common ground in sexuality education. And fortunately, some of my colleagues have already talked about how it's necessary to provide a common ground, a common language, and so the WHO efforts and other efforts have been we have discussed them here, so it's basically this new way of looking at sexual health, and particularly in our World Association for Sexual Health for the Millennium, we established as goal number 4 the need to provide universal access to comprehensive sexuality education and information. And I want to call your attention to the word comprehensive sexuality education, because that has been mentioned once and again over and over, and yet sometimes we do not know what it means. In many cases, particularly in this country, there was the opposition of comprehensive sexual health, whichever that meant, to abstinence only. And then when I talk with colleagues, they all seem to think that comprehensive sexuality education meant only talking about contraceptives and abstinence, talking about other ways of prevention, and not really expanding the concept. So several international consensus documents have been produced. They're seminal documents which try to clarify this concept, and I have color-coded some of the emerging threads so that we may arrive to a common language in this field. The first of them to come out was produced by UNESCO, and I have here the cover, and one of the authors is sitting among us, Dr. Douglas Kirby. And here, first of all, we have the life cycle approach, age appropriate. We have the cultural, this idea that whatever we do has to be culturally appropriate, although these are international documents. And also, I think that it is very important that sexuality education, comprehensive sexuality education, should be science and evidence-based. Later, there was another effort by a joint group, United Nations and Population Council, which produced this book, which is called All in One. It's all in one. It's a curriculum, but it's really not a curriculum. I think it's a more seminal document in which again we see the same threads: the evidence-based, the comprehensiveness, but although it was implied in the UNESCO document, there's a very important theme that emerges, which is the human rights based idea. That and this also comes from the definition, the WHO working definition and the WAS definition on sexual health. And again, for it to be gender sensitive and promotes academic growth and critical thinking, and you again see the common threads about it being culturally appropriate. Then we had another very important document coming from Europe, which is the Standards for Sexuality Education in Europe, which I think can be used beyond Europe. And we again see the same threads once again and again. So it seems that the ideas were being reinforced. There were many people who were at the several consultations, the same people, but other people were joining and coming to this idea of having something which would be really a common ground, something which could be used all over the world, although it would have to be, again, defined and adapted to the national context. And again, in this conference we are launching, not really launching, but we are presenting a document which will be available and is available in one of the books here in the conference, which is again a consultation that was held last year in Madrid. And we have this science-based sexuality education, it's a Madrid consensus, and it puts together all these ideas with, I think it's somewhere, it will be somewhere available, with other newer ideas like having sexual abuse prevention, the preventive approach. So these ideas were taken up in the first meeting of ministers of health and education to stop HIVs and STIs in Latin America and the Caribbean, which took place within the conference 4 years ago in Mexico City, which produced a declaration which is very broad, but again, I think that the most important thing is that they took the language and they were discussing comprehensive sexuality education, and they said that it should have a broad perspective and human rights are right out of the front, as well as the cultural aspects, the diversity, which is implied in the cultural approach and within the legal framework. Finally, this is the common ground which comes out of this. Comprehensive sexuality education, to be called comprehensive, has to be based on science and critical thinking. It has to address the life cycle or the lifelong approach. This is not something for in school. This is not something only for young people. This is for very, very young people, for infants. This is for adults. This is for the old elderly. It has to be human and rights-based. Absolutely. This is a sine qua non now of most of the programs that we are seeing, which are called comprehensive sexuality education. It has to be, of course, culturally sensitive, with a gender perspective, and it has to respect, and not only respect, but celebrate diversity. It should include, it should be really comprehensive, biological, social, etc. And it promotes a culture of prevention, not only repairing the effects of bad sexual health, but culture of prevention, and with a positive approach to sexuality. I think that this is the first time the word appears in this presentation. Mm-hmm. It recognizes the role of pleasure. If it's not positive, if it doesn't recognize pleasure, it's not comprehensive. And on that note, I end my presentation.
So the floor is now open for questions, comments, points of debate or concern that colleagues may have. And I'm going to ask you to come to the microphone, please, and make your intervention. I'm going to ask you to keep them brief, because it would be good to have a good discussion with the panelists. And we'll have about 7 minutes for this section. So let's see if we can get as much comments in as possible. Please go ahead.
Good morning, and thank you to the panelists for this wonderful presentation. I'm Javier Vázquez, Human Rights Law Advisor for PAHO. Many countries of WHO have accepted that the right to the highest attainable standard of health is a basic human right. Most of the countries of the Americas, either in constitutions or international treaties. So recently, both special rapporteurs on the right to health include the right to sexual health as part and intrinsic element of the right to health. And in human rights law, with the right comes obligations, and obligations most of the time belong to governments. So my question to the panelists is, which in your opinion would be the 3 or 4 obligations that governments will have to promote and protect the right to the highest attainable standard of sexual health, the way you have explained? Thank you.
Great question. why don't we take the second question and then, yeah, so give the panel some time to reflect.
Thank you very much for organizing carrying this presentation. My name is Massimo. I'm an HIV activist from New York City. In New York City, we have an AIDS curriculum that's supposed to be grade K to 12. And the implementation of this curriculum is a little bit sketchy. There is a gray area of responsibility between health department and education department, and this conflict goes on and we don't know who is in charge actually. And I wonder if you can maybe talk a little bit. I don't understand why a health issue is, which for me should be controlled by the health department, in this case is controlled by the education department, which, you know, they are not specialists on health, let's put it like that. Thank you.
Great, thank you, great question. So I'm going to ask the panelists to speak first of all to this issue of national obligations, and then we will reflect on the relationship between health and education authorities.
I think I'll take it first. One of the things about the PAHO document was that it made it very clear that this was the responsibility of the government to take this issue on. And that was, I think, a very significant step. It was also made clear that in the U.S. Surgeon General's call to action that this was a government responsibility. And I'll let John talk about what we're doing now, at least from the U.S. perspective. But I think essentially that education is absolutely the responsibility. And again, the other gentleman said this is a problem because is this the responsibility of the education sector or the health sector? And that was the beauty of the interministerial declaration, is that you finally got the two ministers together from all the countries in Latin America. Some of them had never even met one another yet. And this has to be a joint effort, I think, to really provide a basic fundamental education. We are never going to get out of this without basic fundamental education of people. And David Satcher said it so well, is that sexuality education is the equalizer, and we cannot afford selective silence, and that it's a responsibility of the state to make sure that that doesn't happen.
Can I ask for maybe one more comment from either John or Esther?
Well, following Eli, I think that one of the responsibilities of the state is mandatory sexual education within schools, considering that in many countries most of young people are in school. This is something which is very, very important. And it is not the sole responsibility of the education ministry or department. It has to be a joint responsibility with health authorities, considering that sexuality education, it's not only health, it's also human rights and all these other issues that I have talked about.
Yeah, I would really strongly agree with what was just said about this joint responsibility. I would say that in the U.S. sector, educational content has been traditionally seen as the province, as the questioner from New York City indicated, of the education sector. And one of the things we're pushing our health department colleagues is to become much more proactively engaged at their level with that decision making. Education policy in the U.S. is handled at the level of school districts, of which there are over 3,000 in the U.S., and simply saying that's their business, we hope they do it right, we're going to be doing testing and surveillance, we think is no longer enough in terms of how we make this partnership really work effectively.
Great, thank you so much. We have two questions. Please go ahead. You can make them brief.
Charles Stein from San Francisco, and I want to thank the panel for being here so early and for the presentation so far. I liked the approach that I saw presented there about comprehensive sexuality education, but a little bit of phrasing caught my eye and my ear. There was talk of respect for diversity, acceptance of diversity, but then it was phrased as in accordance with each country's legal framework. Is there concern about, from the authors of this document, that provides an out opportunity for countries that have legal frameworks based on religious and cultural traditions of discrimination and violence and homophobia to continue that because it's part of their legal framework.
Great, thank you. And we'll just take the two people standing. Olaf, do you want to come to the mic? And could you please step up to the mic so we can keep this moving? Thanks.
I try to. Yeah, exactly. I hope you can hear me. Olaf Hostig, GIZ Brasilia, responsible for the regional sexuality education initiative with 10 partner countries participating in Latin America. I'm actually interested in we're getting better on the normative level. We are very good on guidelines providing. However, I have a feeling there are many obstacles in order to have actually good quality education happening. And I wanted to maybe get some ideas how to overcome the particular operational and implementation issues.
Okay, so the second part of the symposium will move into the operational and implementation issues, and we will definitely look at that. And the third question, and we will close now.
Yeah, hi. My name is Roy Wadia, and I'm in charge of a small NGO back in Bombay, which is under the AIDS Foundation Heroes Project. We do a lot of advocacy on sexuality, but we find that more often than not we have to work around the system rather than with it. Even back in India, where there has been, you could say, some advances made in the HIV challenge, there is no mention of sexual pleasure at all. How do you, despite all these wonderful pronouncements, where you even talk about sexual pleasure now as part of a doctrine, work around the politics of the health and education authorities? So can you give us some examples where it's actually succeeded?
Excellent. So I'm going to ask the panel to give brief responses up to the question on diversity and pleasure in politics. And we'll save the operational question until the end of the second three panels. So who would like to jump in first?
Well, I'll say that I mean, you've named an extraordinarily important and difficult issue, and at least in the U.S. context, we have found that this, in the examples of which we're aware where this has worked most effectively, it's been done around particular identified problems in the community. The state of Oregon, for example, in the U.S., has developed a statewide youth sexual health plan, which grew out of a teen pregnancy prevention program. So recognize that teen pregnancy had not been well dealt with in Oregon, and that it was a nidus of concern that people could get their heads around, and therefore the need to work with partnerships dealing with other aspects of public health, but much more importantly to talk holistically and positively around sex, parental-child communication, sex in the schools, has begun to grow out of it. So I think at least in that circumstance it was problem identification, problem solving, with old way of doing business recognized as not being sufficient effective.
Yes, well, I'm going to take up the initial question. I think that these respect for the legal rights system of each country, this was introduced by the ministers themselves. I mean, you couldn't expect less from governments. But on the other hand, there is the Declaration of Human Rights as a basic document which, again, establishes a common ground for all countries in the world. And we are really calling upon all the people working in this field to have this as the basis. And again, where cultural differences violate human rights, I don't think that then the cultural differences can be accepted. And this is, I think, that it's also becoming a common ground. Of course, we understand that within the concept of nations, there are many countries who do not accept this, although they have signed the Declaration of Human Rights. But even so, the pleasure, that's a very